It is Eastern Standard Time. I had to think about it for a minute. It's been a lot going on, but all good things. I appreciate you guys liking, inviting, and sharing as you guys come on. We're going to be talking about sleep apnea. You know, I did a whole video on the proper way to sleep, and now I'm going to talk about some abnormal sleep things, I guess. Sleep apnea, snoring. Yes, snoring. Snoring can be an indication of disease or could cause certain types of diseases. So when you guys come on, please invite your friends and your family to come on, your Facebook friends and family to come on. And if you're on Instagram, please tell people to come on. And if you're on YouTube, please like, invite, and share. Share with us. Tell people to subscribe to Medical Monday. Please, Grace Patterson Medical Monday, because there's another Medical Monday where it's talking about medical marijuana, which we also did a show about that too. Hey, Tanisa, thank you for joining on. Hey, Tawana Knowles, thank you for joining on. Thank you for sharing, because sharing is caring. Thank you for sharing the events that we post. I'm Dr. Grace Patterson, managing owner of Bethesda Holistic Center and Everything New Regenerative, Restorative, Anti-Aging Medicine. Yes, concierge services. We did a whole show about that as well. So I think I'm gonna do coming up soon, regenerative, restorative, anti-aging. I did a show on that also, but I think I need to revisit that since we're going into the new year, 2019. Can you believe it? Oh my goodness, Thanksgiving is this week. We have so much to be thankful for. Going out every day and to people's home. I often think about that scripture sometimes where he said, when I was sick, you came to visit me. And he said, Lord, when was you sick and I came to visit you? And he said, anytime you go and visit anyone or visit someone that's sick, shut in, or in prison, or whatever the case may be, you visit Jesus. Isn't that amazing? And so our visiting practice actually is a living testament or testimony of that word. And as we go out and as we are an extension of the kingdom of God through our spiritual leaders, Apostle Wayne T. Jackson and Dr. Beverly Y. Jackson, we are an arm, an extension of that ministry as we go from house to house, home to home, visiting the sick, disabled, and shut in, those that have a taxing effort getting out of the home. So if you're interested in those services, we come out, do evaluations for mobility, for people to be evaluated for home care services. That means physical therapy, occupational therapy, someone who may have just recently had a stroke and needs speech therapy, nursing to come out to monitor vitals, your vitals, which means your blood pressure, your pulse and respiration, and pulse oximeter. Sometimes you can qualify for a home health aide. Someone can help with your what they call activities of daily living. Simple things, just showering, combing the hair, shopping, fixing your own food. Some people, when they have a health challenge, it is difficult for them to do those things. Even it's hard for some seniors to reach their hands over their head to comb their own hair. Could you imagine that? But anyway, we help evaluate for those services and get those services in the home if a person qualifies for that. So if you're someone under the sound of my voice, hey Doris, thank you for joining on. Please like, invite, and share as you guys come on. Thank you so much for joining in. But if you know anyone who needs those services, please give us a call at Bethesda Holistic Center, 248-356-1111. That's 248-356-1111. That's 248-356-1111. And our website is www.bw-center.com. I've been getting a lot of inquiries about concierge services due to now we're in open enrollment, and the Affordable Care Act that was given to us through President Obama during his time of leadership is still in effect, and people are still having challenge with picking an appropriate coverage in regards to if the premium is low, then the deductible is really high. And if the deductible is really high, then the premium, if the deductible is really low, then the premium is really high, just like car insurance. And guess what, guys? Being that the law has passed for recreational medical, along with medical marijuana and recreational marijuana, those insurance coverages, those rates in the Metro Detroit area are going to go up, along with healthcare coverage as well. Mm-hmm. Yes, but anyway, for those of you who voted yes on that proposal, they didn't tell you about that part. They didn't tell you about that part, right? Hey, Susan, thank you for joining on. Please like, invite, and share. We're going to be talking about sleep apnea, snoring, um, how it affects your health. So I'm going to read what is sleep apnea based on the National Heart, Lung, and Blood Institute, the NHLBI. Sleep apnea is a common condition in the United States. It can occur in the upper airway, becomes blocked repeatedly during sleep, reducing reducing or completely stopping airflow. They record the number of episodes or slowed or stopped breathing at a number of central sleep apnea events detected in an hour. So, how does that affect a person? That has sleep apnea, right? Sleep apnea. Just think about it. They said there's episode where there's stop breathing. So if there's stop breathing, there's stop oxygenation. If there's stop oxygenation, the tissue is not getting the oxygen that it needs. If it's not getting the oxygen that it needs, it damages the tissues. And when it damages the tissues, there is a cascade of events that happen in regards to inflammation that causes the airway to become inflamed, or throughout the whole body. If it doesn't get oxygen, the tissue is damaged, so there's inflammation throughout the whole body. So that means the blood vessels, I mean everything, the nerves, the brain, all of that is suffering from the lack of oxygenation, which is not a good thing. So top causes of sleep apnea or snoring, because you can snore and not have sleep apnea, but most oftentimes you can't have sleep apnea without snoring. Okay. Okay, let me say that again. A person can be a snorer or have snoring, and not have sleep apnea. But most oftentimes, when people have sleep apnea, they are a very loud snorer. Yes, they snore very, very loud. It brings me back to my childhood days. My neighbor used to have a boarder. His name, I still remember his name. He's probably passed on and being gone on with the Lord, but you could hear him snoring from his upstairs bedroom, and we're down in the driveway, standing outside, hearing him snore. That is loud. Thinking back on it, he probably had sleep apnea. He was a heavy set man, which brings me to one of the causes of sleep apnea or loud snoring is obesity. No, you guys know that obesity is a common cause of sleep apnea in adults. People with this condition have increased fat deposits in their necks and can block the upper airway. So sometimes what happens is you can tell if a person has a heavy, sexually pleasingly plump midsection, and if their neck is fat, they probably snore and they have a problem. So one of the screening modalities that we do when we go to the home, because now I am finding out, and with all my research and studying, inflammation is the major underlying cause for every major disease that is out there, from high blood pressure, diabetes, strokes, degenerative, demyelinating nervous system diseases, from MS and lupus. All those diseases, the underlying cause is inflammation. And what is associated with inflammation most oftentimes are people that are overweight or obese, because what happens, the adipose tissue doesn't make enough adipoctin, which allows the body to produce antioxidants to keep inflammation down. So the adipoctin is not there, so the cascade of inflammation is constantly going. So inflammation is rampant, okay? And so if inflammation is rampant, then you have a whole lot of free radicals, which is, so if you have a lot of tissue damage, then you have disease, right? Does that make sense? So one of the causes of sleep apnea or causes is obesity. So if someone is really, really snoring really loud. So what we do, one of the screening things that we do, we measure the neck. So if a male or man has a neck size greater than 16.5 inches, or a female greater than 15, that increases their risk of having sleep apnea, or obstruct some type of obstructive disease. So if you're a provider under the sound of my voice, you need to be screening your patients for sleep apnea, asking them, especially if they're overweight, if they snore, if they're significant other, or even ask them, do you ever wake yourself up out of your sleep from snoring? And if the answer yes, you need to screen them for that, because it is a gateway of other diseases, because lack of oxygen equals disease, and lack of oxygen, they may go to sleep one night and not wake up. I've known of situations where young people, have gone to sleep and not have woken up because they were loud snorers and no one ever assessed it or talked to them about it. And especially if they partying and hanging out and they like to drink, okay, so, and all that kind of stuff. So that increases airway obstruction when people party or drink or alcohol. But that's, we're going to get to that. I'm getting a little ahead of myself. Another cause of attributes to sleep apnea is large tonsils. Tonsils may contribute to sleep apnea because they narrow the airway also. So you have the person that may be sexually pleasingly plump or obese, along with large tonsils, bad combination. So when a person lays flat, that fat, okay, this is your airway. When a person lays flat with large tonsils and with the fat, it closes the airway off. So when they're snoring, it may be a little airway, but everything is vibrating, which causes this loud snoring noise, right? Another thing that they say may cause sleep apnea is endocrine disorders. Endocrine is part of your body, which is endocrine glands or organs that's in the body, your thyroid, your pituitary, a person's ovaries, or testicles. All of that is part of endocrine. Parathyroid glands are all part of the endocrine system. So the endocrine system produces hormone that can affect sleep-related breathing. The following are examples of endocrine disorders associated with sleep apnea, and that's hypothyroidism. Hypo means low acting or not acting, low active thyroid. So thyroid regulates metabolism. So if the thyroid is not working like it should, metabolism is running slow, then a person may gain weight, be depressed, is cold all the time, and that's what we call the conditions of call signs and symptoms of. So people with this condition have low levels of thyroid hormones. This affects part of the brain that controls breathing. So that is important too. So think about that. If someone's have hypothyroidism, they may have snoring problems with sleep apnea because the thyroid hormones secrete hormones that controls part of the brain for breathing, which is very, very important. As well as nerves and muscles used to breathe. So it's two things happening. If a person have hypothyroidism, their hormones are not being utilized or created or produced enough to control the center for breathing in the brain, and causes affects the muscles for breathing. People with hypothyroidism can also be diagnosed with obesity. I just said that, which can cause sleep apnea. So acromegaly. What is acromegaly? People with this condition have high levels of growth hormones. So these are people, the man in the world Genesis, world records, the tallest man in the world. He has a huge head and big hands. That is what we call acromegaly. Everything is just huge. This growth hormone, this condition associated changes with facial bones, swelling of the throat, and our equal size, an increased size and tongue. These changes can contribute to upper airway and lead to sleep apnea. So this is also a hormone disorder, polycystic ovarian syndrome, PCOS. This is classic for women. Because what happens here is polycystic ovarian syndrome. The hormones are not being secreted like they should to cause proper proper cycle, so a woman may not ovulate like she should. So PCOS is also associated with overweight and obesity, which can cause sleep apnea. So PCOS also causes hirsutism. What is that? A lady with a mustache, a lady with a beard, because of hormones. And I did a show on that before also. I guess I've done shows on so many things. I've been doing this for 2 years now, every Monday, trying to think of a show. But sleep apnea, PCOS, polycystic ovarian disease can also be associated with sleep apnea because of the hormones and also being overweight. Let's talk about neuromuscular conditions that can contribute to sleep apnea. Okay, and conditions interfering with brain signals and airway and chest muscle can cause sleep apnea. Some of these conditions are stroke, what they call amyotrophic lateral sclerosis or ALS, or Shari malformations, myotonic dystrophy, or post-polio syndrome, dermomyositis, myotosis, and myasthenia gravis, and Lambert-Eaton myasthenic syndrome. So all of those big words is just saying stuff that affect the nervous system, that affects muscles, that affect breathing. Okay, that can be from demyelination of nerves. What are nerves? I explained that before when we did nerve damage. Think of a nerve like an extension cord. It has a protective sheet over it, and the inside of the cord is what sends messages to brains and different parts of your body from your brain to different parts of the body to function or to move. So if that's damaged in any way, the signals can get scrambled and not perform like they should. So think about that in sleep apnea. If your brain is telling the muscles of the neck or the tongue or whatever to constrict or to relax, or even in the accessory muscles, which are in the neck, or the muscles that are in the lungs. This can affect a person's breathing pattern while they're sleeping, causing a deoxygenation event or lack of oxygen event, which can cause disease. Kidney failure. Sleep apnea is commonly found in people who have advanced heart and kidney failure. These patients may have fluid build up in their necks that can obstruct the airway and cause sleep apnea. So if you are a provider or someone under the sound of my voice that knows someone that has renal failure and kidney failure, or kidney failure or heart failure, you need to be screening them for sleep apnea, because they already are compromised because the heart failure part, they're not getting the oxygen to their tissues like they should because the heart is not pumping. But the fluid overload, the backup of the fluid from the kidneys and from the heart not pumping like it should, can accumulate in the neck. So this can cause a fat neck, and which can obstruct breathing, which can cause an apneic event or lack of air and which can cause further damage. Genetic syndrome. So in this case, what comes first, the chicken or the egg? So in some cases, did the sleep apnea come first that caused the heart damage, the high blood pressure, the renal disease, or did the heart disease or the kidney damage cause the sleep apnea, which causes breathing problems? So the way I look at it, sometimes it's the sleep apnea that comes first. It goes unattended to or unaddressed for so long, for so many years, that they have so many apneic events of lack of oxygen, which causes tissue damage to the heart, cause tissue damage to the pancreas, which cause diabetes, that cause tissue damage to the kidneys, which cause renal disease, along with causing hypertension. Some people have horrible control of their blood pressure because they're having apneic events in the middle of the night that are going unaddressed. Genetic syndromes can also contribute to sleep apnea. So that means genetic syndromes or malformations of the mouth or the neck, or things like that, tongue being further back in the mouth may cause sleep apnea. Genetic syndromes include cleft lip or cleft palate. You've seen those. I love watching documentaries when surgeons and facial surgeons, they go to different countries to make corrections to cleft palates and cleft lips for people, congenital central hypoventilation syndromes and all of that. So that can contribute to sleep apnea. Premature birth. Babies born before 37 weeks of pregnancy have a higher risk of breathing problems during sleep because their lungs didn't mature. So what they normally do before delivery, they try to give the mom some steroids to rapidly develop the lungs in the child. So sometimes it works, sometimes it doesn't, but it also can contribute to sleep apnea. So risk factors for sleep apnea. Listen to this: as a person gets younger and younger, or mature, or age, there are many risk factors for sleep apnea. Now, I want us to stop here and say this for a moment. Most times we associate snoring with men. Men snore a lot. Women can snore too. Now, I know I have some girlfriends, as my mother said, can call some hogs. So, any way it goes, be it male or female, if there's loud snoring, it needs to be addressed. Risk factors of sleep apnea, some risks, sudden unhealthy lifestyle habits and environment can be changed. Other risk factors such as age, family history, and genetics, race, ethnicity, and sex cannot be changed. But other lifestyle things we do have control over, we can prevent. We can't prevent us getting younger and younger or maturing, but we can age much gracefully by eating the right thing, making right foods, making sure we get a right amount of sleep, make sure that we the right make food choices so that we can maintain the right body habitus, the body size, make sure we're hydrated. Sleep apnea can occur at any age though. The risk of sleep apnea increase when we get older, when a person gets older. In younger adults, sleep apnea is more common in men than women, but the difference decreases later in life. Normal age-related changes is how the brain controls the breathing during sleep, particularly or partially explain increased risk as we get older. Another risk factor is unhealthy lifestyle. Drinking, alcohol, smoking, and overweight and obesity can increase your risk of sleep apnea. Alcohol can increase relaxation of the muscles in the mouth and the neck. I said that earlier. The brain controls sleep, but if the muscles are not engaged while a person is sleeping, it can block out airway, and a person can go to sleep and never wake up. Smoking can cause inflammation, yes, in upper airways. So if it's inflamed, then it's hot, then it's swollen. So if it's hot and swollen, then it's closed off, right? Unhealthy eating patterns, lack of physical activity can lead to overweight and obesity, which can result in sleep apnea. I have been doing some reading and studying because I have an exam coming up, so be praying for me, huh? Along with the work and all the other things that I'm doing. But me studying helps me with my Medical Monday and sharing information with you. To God be the glory on all of that, so I'm excited about that. But one of the things that I have been studying is about being overweight. Being overweight, it should be treated as a disease, and it should be. Most oftentimes people treat a person as overweight as a failure to control their behavior in eating. It is a two-edged sword, because you're not if you're under the sound of my voice and you're someone that is overweight, you're not a failure. Okay, the system and our food is designed to keep people overweight and struggling with weight. So it's not your fault, okay? And at all, because then along with the system being the way that it is, and the things and the additives that they put in our food, how many of you heard of comfort food? Okay, comfort food, when you eat it, it makes you feel so good. Okay, that is a form of addiction. Okay, people can be addicted to food. So if someone is addicted to drugs, sometimes they can be a bad element. I'm not talking about that, but addiction is a disease. So from being drugs, from crack, methamphetamines, marijuana, whatever the case may be, alcohol. Some people can be addicted to food. So please, we need to be looking at this a lot differently, and looking at it as a disease, and prescribing more prescription to help with appetite, as we work with the people with psychotherapy and therapy to readjust their mindset and their food choices all together, just like we would do with someone that has an addiction problem. We need to be treating it the same way. Now, okay, we don't want to label people or put a stigma with it, but it is what it is, because that's why at a certain point, people resort into surgery to control their weight. Okay, so as we release as we release the weight, then the airway opens up, right? So if a person doesn't, then surgery needs to be done on both sides. For obesity, you have all these options now for ruling why. That's a form of gastric bypass surgery, sleeves and balloons and all this other kind of stuff to shrink the stomach and all that stomach stapling to um, um, to allow a person to eat the right amount of food to release the weight. Okay, but at the same time, before they even go through that, they do a lot of evaluation, even psycho evaluations, to find out why a person is doing this. So most oftentimes, people for weight reasons, which is highly associated with sleep apnea, the two and two go together. So most oftentimes, before we go to surgery for sleep apnea, we will encourage our patients to try to release the weight. So we need to address it as part of the disease process, not as a person being a failure and controlling themselves. Obesity needs to be looked at as a disease, okay, and be treated as such. And because when we treat or have a mindset as it being a failure, then people have depression and then they feel as a failure. It's just a big snowball, just a big old ugly mess. So we need to treat it for what it is, okay, as a disease. Family history and genetic can contribute to sleep apnea. Researchers have identified family history as a risk of sleep apnea. By maintaining a healthy lifestyle can reduce the risk. Studies have twins have shown that sleep apnea can be inherited. Yes, I've had a conversation with somebody this week that said I snore and my son snores horribly too. And let's say this, even though we may screen for sleep apnea, a person may not meet every point of sleep apnea, but they still may have it. But they may not meet the screening criteria. But I think if a person has snoring for a long extended period of time, they need to be screened for it. Race and ethnicity can contribute to sleep apnea. United States sleep apnea is most common among blacks, Hispanics, and Native American, then among whites, our Caucasian counterparts. Screening and prevention. The screen for sleep apnea. Your doctor will review your medical history and symptoms. To prevent sleep apnea, your doctor may recommend healthy lifestyle changes, behavior modification, eating right, and things to promote and decrease inflammation. Screening for sleep apnea. Oh, well, go pee pee. Say hi to everybody. Hi. Well, go. Go potty. Go potty. Go. Sorry. Oh, that's okay. Life happens. But anyway, let's get back to sleep apnea. Healthy lifestyle changes to prevent sleep apnea, screening for sleep apnea. So what we do at our practice, we actually screen for sleep apnea now. We measure the neck and we ask questions. We ask about high blood pressure, heart disease, diabetes, if a person ever had stroke, suffer from depression, and have been told that they had a diagnosis of sleep apnea. Is there any lung disease? Is a person having a hard time falling asleep? Narcolepsy, which means they just like that, in talking in the middle of a sentence, they just go to sleep. Do they take sleep medication? Do they use oxygen, nasal oxygen? Restless leg syndrome, which means that there is decreased decreased blood supply in the lower legs, and numbness and tingling would cause a person to move around a lot. Is that because think about this, is that because of sleep apnea occurring and the person is not getting enough oxygen throughout the whole body, so the legs feel restless and numb and tingly? So that's a question for research, and that needs to be part of that. So pain management. Okay, we talked about pain management. I talk about pain all the time. If a person is on an opiate is respiratory depressing, which means it can cause the muscles to relax, the lungs to be relaxed, which can cause sleep apnea. Okay, opioids, we give it to people that are on hospice and on making their transition. They give opiates to slow the breathing down. okay, to make their transition more peaceful. So if you're someone under the sound of my voice that has been on chronic opiates for a very, very long time, you definitely should consider being screened for sleep apnea because your respiratory system is operating at a very, very slow and low rate because of the opiate, okay, or the opioid. A opioid is the natural form of heroin, the poppy seed, and an opioid is the synthetic form. Okay, but the basic structure is heroin. So if you guys know anyone that is under the sound of my voice that is on an opiate and have been on it for years, they definitely need to be screened for sleep apnea. Okay. Let's see, healthy lifestyle changes. We talked about that, eating healthy, quit smoking, decrease alcohol intake or stop drinking altogether, and make sure you become active. Okay, look for a diagnosis. This is how doctors are trained to look for it. We ask again, do you sleep so loud, snore so loud, you wake yourself up, or if you have a significant other, they like, ooh, they sleep so loud, I want to go into another room, or do they wake up gasping for air? Okay, these are the things that we ask for. Or they're snoring so loud that you can't even tell that they're gasping for air, so you may not be able to distinct, or they actually stop breathing. It's like and there's nothing, there's a pause for a few seconds. If that is the case, that is classic for sleep apnea. Daytime sleepiness. Sometimes daytime sleepiness can be masked by supplements or things, caffeine and coffee. It can be masked so a person may not have daytime sleepiness, but most oftentimes a person that has severe sleep apnea will have daytime sleepiness. So one of the things that we ask is, when a person is sitting and reading, do they doze off to sleep? Watching TV, as soon as they sit still, they doze off to sleep. Sitting inactive in a public place, doze off to sleep. A passenger in a car for more than an hour, doze off to sleep. Lying down to rest in the afternoon when circumstances permit, doze off to sleep. Sitting and talking to someone and just doze off to sleep. Sitting quietly after lunch without alcohol, you doze off to sleep. In a car while stopped at a light for a few minutes and doze off to sleep. It can be sleep apnea, or it could just be that a person is not getting enough sleep. But that's why the sleep study is very, very important, that we do that to make sure. So we talk about, on average in the past, how often have a person snored or been told that they snore. So it's never, rarely, sometimes, frequently, or almost always. They have to give that, and each question gets a point. So based upon the cumulative points, they're either low risk, no risk, low risk, moderate risk, or severe risk, or high risk. Okay, so do a person wake up choking or gasping for air? And have they ever been told that they've been, that they stopped breathing or anything like that? So those are the things that we ask. And I just went over that basically about for screening questions that we can ask. But also common signs is, like I said, reduce or absence of breathing, known as apneic events. Frequent loud snoring, gasping for air during sleep. Common symptoms of sleep apnea: excessive daytime sleepiness and fatigue, decrease in attention, vigilance, concentration, poor motor skill, verbal and visual-spatial memory, dry mouth and headaches when awake, sexual dysfunction or decreased libido, waking up often during the night to urinate. Okay, so that can be a sign of sleep apnea. Okay, complications of sleep apnea. Okay, things if a person has these diseases, can also be associated with sleep apnea. So that's asthma, AFib, cancers, chronic kidney disease, cognitive and behavior disorders such as decreased attention, I said vigilance and concentration. I read all of that. Dementia in older adults and children. Sleep apnea may be associated with learning disabilities. So we definitely need to screen for sleep apnea in children that have learning disabilities, especially if they're sexually pleasingly plump. Okay, we definitely need to screen for that. Okay, or if they are falling asleep in class. Okay, they may have asthma. associated with learning disabilities, they need to be screened for sleep apnea. Let me say that again. Children, small children, that are falling asleep in class, learning disabilities, need to be screened for sleep apnea. A disease in the heart and blood vessels such as atherosclerosis, heart attacks, heart failure, difficult to control high blood pressure. That's classic. That is so classic. If you have providers, be it other doctors, nurse practitioners, nurses, physician assistants, you know you've done everything that you know how to do, and your patient is saying, "Doc, I'm eating right, I'm decreasing my salt intake, I'm doing the dash food choices, I'm they're exercising, they're taking their medication, and you cannot seem to get that blood pressure down." Please screen for sleep apnea. Please screen for it, because if they're having apneic events in the middle of the night, I don't care what you do, that blood pressure is not going to be controlled, because apneic events increase inflammation, increase high blood pressure. Okay. Stroke. So you got to want to make sure that you do that. I remember this when I was a resident. I think I shared the story when I did about sleep before, and I briefly touched on sleep apnea. I had a young lady, a Caucasian young lady, and I can't remember what she did for a living, but I think she was in corporate America, and dressed very, very nice. And she was like, "Dr. Patterson, I'm sleeping all the time. I'm so sleepy. I'm at a light and fall asleep." And she said, "I'm telling doctor after doctor after doctor, and they just telling me I need to lose weight." So I sent her for a sleep study, and the sleep study doctor told her if she had not come when she did, she might have went to sleep and not have woken up. So she had to go for surgery for her sleep apnea, and what they do, they call it a stripping. So what is a stripping? They took out her tonsils, they took out her adenoids, the little thing that hang down in the back of her uvula. They stripped all that out, and then we worked together for her to release the weight. And she was so thankful and grateful, because she had other stuff going along with the the overweight and sleeping all the time. Her blood pressure was not barely controlled, but by us sending her for a sleep study test, we found out what was going on with her and actually saved her life. So eye disorders such as glaucoma, dry eye, and what they call keratoconus. So you definitely need to be sleep if a person has glaucoma. Instead of going to get medical marijuana for your glaucoma, please go get tested or get screened for sleep apnea. Because again, if it's sleep apnea causes blood pressure peripherally throughout the body, and it causes the heart to have problems, it can cause ocular pressure, the eye pressure, to go up too, which is glaucoma. Metabolic disorders including glucose intolerance and type 2 diabetes. Again, if a person is having apneic events, or events where they're not getting oxygen to tissue, so that means the tissue is inflamed, those receptors will not recognize the insulin. So if it's not recognized the insulin after a person eats, then that person has type 2 diabetes. So therefore they need to make sure that they're screened for sleep apnea. For someone that have metabolic syndrome, which means that they're overweight, have a body habitus or waist circumference over what? Do you guys remember that? Okay, does anybody remember what the waist circumference should be for a man or a woman? Okay, let's say this. If you're 6 feet, it should be half your inches to be normal. Anything above that, there's an issue or a challenge. And so let's say, for instance, if a woman is 5'6", 66 inches, her waist circumference should be only 33 inches. Anything above that and beyond that, that it needs to be addressed, along with the metabolic syndrome, waist circumference, high cholesterol, high blood pressure on medications, the metabolic syndrome. Along with that, they need to make sure that they're screened for sleep apnea. Pregnancy complication, including gestational diabetes, high blood pressure, as well as having a baby with low birth weight. Okay, so any of you OBGYNers out there, if you're having, I'm quite sure that you don't do that, but you should. If a woman has gestational diabetes and she's gained a whole lot of weight, and she has eclampsia or whatever the case may be, and you cannot get that blood pressure control. I know the treatment for eclampsia is to deliver the baby, but if a person is preeclamptic or whatever the case may be, and you're monitoring them, you might want to consider a sleep study. And if you can address the sleep study issue, then you may be able to control the blood pressure, and then you may not have to deliver so early, or get the baby out earlier for eclampsia. If you can, if the sleep apnea is contributing to the poor blood pressure control, that one didn't cost you nothing, OBGYNs. But it's a good thing to consider. Diagnosis, medical history, physical exam, sleep studies, ruling out other medical conditions. We definitely need to do that by blood tests, ultrasounds, especially pelvic ultrasounds for PCOS, to examine ovaries and detect cysts. We definitely want to do blood tests to see if there is dihydroepiandrosterone sulfate test for PCOS. We definitely want to check that, and growth hormone. If we suspect that, we definitely need to do that, okay? So treatment, how would you treat that? After you do the sleep study test, find that the person has sleep apnea. What do you do to treat it, okay? What you do, of course you do behavior modification. You talk about, hey, you need to change some things in your life. Breathing devices, you heard of the CPAP machines. You've probably seen them on television where they talk about this CPAP machine was so dirty, they need to clean it because they had all these bacteria and anaerobes and all this other kind of stuff. They stay sleep all the time because a positive CPAP, what it does, it pushes so much pressure to open up the airway, so the air can get through, so the person will not have apneic events. So that's one treatment. But the best, along with that, you should just not do that alone. Oh, I have my CPAP machine now. I don't need to do anything else. Yes, you do. You need to make sure that you do all the ththings that you need to do. Hey, Jaquinder, thank you for joining on. Hey, Authentic, thank you for joining on. You also need to do everything else in your power to open those airways and make sure they're patent, so that you can get that. Therapy for facial and muscles. Children and adults with sleep apnea, they may have therapy for facial muscles and stuff like that. Surgical procedures, which I talked about, tonsillectomy, maxillary and jaw advancement, mandibular, pushing it forward, making sure that airway stays open. So those are the things that you need to do. We have a test that is coming to our practice within a matter of a couple of before the beginning of the year, where you can do a sleep study in your home. You don't have to go to a study lab or anything like that. It can be done in your home, and it's self-automated. It's a little device that you wear on your head like a headband, and then you put the nasal thing in your nose so they can detect your breathing. It's a lady's voice that tells you everything that you need to do before you go to sleep, and it tells you, lay back, now you can go to sleep. And it tests how many times a person have any apneic events, the snoring, how many times they turn over, how many times they move, how much they are awake or get up, and all of that. And then once you're done, it's 2 nights of the study. Once it's done, we get the device back. We upload the information into our computer, and a sleep study specialist reads that and gives us a printout and tell us whether you not have sleep study or not, sleep apnea or not, and what we need to do about it. Most insurance companies cover it. It's part of our concierge services. It's not expensive at all for 2 nights to get this done, because it is what it is. If you're someone under the sound of my voice that's snoring all the time, don't have insurance, we can help you economically. You are worth it. Like I said, you don't want to go to sleep and not wake up. And sleep apnea can contribute to that, especially if you're someone young and you live life, you enjoy life, you go out, hang out with your friends, you may have a glass of wine or 2, or hang out or drink a little bit, but that increases the risk of having apneic events while sleeping if you're a loud snorer, but also increases your risk of mortality, which means dying. So it is very, very important that you guys consider in doing that, okay? living with sleep apnea, like I said, behavior modification, the screening, the machines, eating right, and all that other kind of stuff, decreasing the inflammation throughout the body, controlling other core mortalities and morbidities, I should say, that goes along with it. Though the high weight, the asthma, the COPD, the congestive heart failure, all of that goes together. So we have to make sure that all those other things are addressed. Okay, what if you're someone under the sound of my voice is just like, I just snore loud. So you need to figure out why you snore so loud. You probably tried the nose strips. You probably tried the mouthpiece. You've tried everything, and you're still snoring. So you definitely need to be screened. Okay, you may not have it to the point where you're waking up gasping for air, but if you're snoring and it's waking you up out of your sleep and it's affecting those around you, you need to be screened. Okay, it's very, very important that we do that. So that's all I have for sleep apnea. It is 8:45. I don't know. I need you guys to help me out. It's the end of the year. I think we have what, next week is the last week. Next Monday is the last Monday in November, and then we're going to be in the last week, the last month of the year, right? So, my goodness, I need to look at a calendar. Let me see if I can find a calendar right quick so we can look at it, so we can figure out what are we going to do for the last. Can anybody tell me what day Christmas falls on? Oh my goodness, I know. Happy Turkey Day. We're going to talk about that for a minute while somebody's looking up on the calendar to tell me. Hey Jonah, thank you for joining on. Please like, invite, and share as you come on. Hey Tawana, thank you for joining on. Hey Jaquinda, thank you for joining on. When is Christmas this year? Does anybody know? Let me see here if I can find out when Christmas is. Let's see. Anybody know when Christmas is? Let me see here. See what we got here. Today is the 19th. So, anybody? Is anybody there? Hey, Doris. Hey, Latanya. Let me see. Sorry. Hey, Bridget. Hey, Marguerite. Hey, Kathy. Hey, Jaquinda. Does anybody know when Christmas is going to be? Anybody? Let's see. Let's see what we got here. But anyway, I need some show ideas. Thanksgiving is this Thursday, which the 23rd. But anyway, I need some show ideas. I'm running out of show ideas. I think I'm going to do fibroids because I've been getting a lot of inboxes about fibroids. So I think I'm going to probably do something on that before the end of the year is out. Let's see. What does that say? I'm trying to read some of these things. It says, Dequinder, how does sleep apnea affect the kidneys? Oh, well, how it affects the kidneys, you got to remember if there's an apneic event or deoxygenation, right? Is anytime you don't have oxygen, there's damage done. Okay, so how long, if it keeps going on for a long period of time, just thinking about that, there's inflammation that happens. There's a cascade of events that happens when somebody stops breathing, and there's the oxygen. Inflammation affects the vasculature, bios, the nephrons, our capillaries, and all of that. All of those are blood vessels. So when you have inflammation throughout the body, you have arteries that go into the body, into the kidney, and you have veins that come out. So if the artery is inflamed, then you have all this stuff that's going on, that the cascade event of inflammation. After a while, what happens when you get decreased blood flow to the kidney, because now the arterial or the vascular to the kidneys are inflamed, right? And if they're inflamed, you don't get enough blood flow to the kidney, and then if you don't get enough blood flow to the kidney, what happens? You don't get the filtration like you should, right? Then the body is toxic, and then what winds up happening, blood pressure goes up, and then if blood pressure goes up, what happens to the kidney? The kidney doesn't get what it needs, and then it starts to shrink down, and that's how you get renal disease. So an apneic event is a whole big thing. You said Christmas is on a Tuesday. So I don't think I'm going to be doing Medical Monday on Christmas Eve. If I do come on Christmas Eve, it will be to say, hey, Merry Christmas. So thank you for DeQuinda for checking in on that. Yeah, DeQuinda, look at you. I'm looking at some of your responses here. 40 centimeters for men and 35 centimeters for me. That's right, DeQuinda. You go, girl. So hey Kathy, thank you for joining on. So that's how that affects the kidneys, sleep apnea. That's deep. So like I said, a lot of people say, that people with heart failure, kidney disease can have sleep apnea, or it can cause sleep apnea, or is it that they had sleep apnea the whole time that causes the disease? You can look at it both ways. But I really do believe that if a person has snoring for a long period of time and it's irritating, they need to be screened to make sure that all is well with them. It's very, very important that you do that. Is there any more questions or concerns? Oh, so that means that if Christmas is on a Tuesday, that means New Year's Eve and New Year's Day is probably on to the following week, Monday, Tuesday. So there's going to be a short month in December for Medical Monday, and then we're going to be in 2019. Can you believe it? Oh my goodness! So I think this will be my third year. Is it my second or third year doing Medical Monday? I don't know. But I've been doing it for a very long time now, and I'm excited about it. It seems long. 2 years is not long, is it? Or 3 years is not long either. But I appreciate you guys being so faithful and coming on, liking and sharing. And I want you guys. Could you guys do this for me this year, before 2019? I would like for you to go to the Medical Monday page, Facebook page, and post something. How Medical Monday has impacted your life, changed your life, has influenced you in whatever way, be it good or bad. I need to know. So other people can know too. And some of you have, and if you want to do it again, please do feel free to do so, to encourage those that come to the page, and share it with your friends. Share the post that you post with your friends about Medical Monday. Okay, it will be so greatly appreciated. One of the other things that I wanted to talk to you guys about, we talked about Medical Monday, we talked about the shows, we talked about sleep apnea, we've talked about shows that are coming up, we talked about the holidays, we talked about the new year, we talked about you guys going to post and say how Medical Monday has affected you in your life, and how it has hopefully has been a blessing to you. Getting on here every Monday to share with you has been a blessing to me, because when you give, this is my way of giving back. So God has blessed me with the knowledge and the information and with this profession, so I definitely want to give back. Yes, I do. So hopefully this has been a blessing to you all. These last couple of years that we have been doing Medical Monday. The time now is, oh, we still have a few more minutes. Any more questions about anything? I just want to see. It says, I was diagnosed with sleep apnea about 5 years ago. Okay, so what have you done do you have a machine? What have you done to get better? Do you need help with that? I sleep like a baby. That's good. Hey, Doreen Cooper. Hey, Kenyatta. Thank you for joining on. Hey, Patrice. Hey, thank you for joining on. Hey, Miss Nini. Thank you for joining on. Hey, Linda Manrique. Thank you for joining on. I appreciate you guys joining on. Hello, hello, hello. Hey, Mio Robinson. Thank you. Hey, Shanitra. Thank you for joining on. Hey, Danielle Johnson. Please, if you are interested in, hey, Susan, make an appointment for a consultation or anything like that, and you need to speak with me or talk with me. Our telephone number is 248-356-1111, 248-356-1111. Even if you're interested in getting screened for sleep apnea, we can work with you to get that done for sure, in the privacy and the comfort of your own home. I'm so excited about sharing that with you guys. Our website is www.bw-center.com. That's www.b as in Bethesda, W as like in holistic, center.com. Please go to look at our website. Please subscribe to our YouTube page, Medical Monday, Grace Patterson. Go subscribe to our page, please, and share the link with your friends to subscribe to our page as well. Please do that. Share more followers. Hey Jonah, I think I just wanted to make sure that I said hello to everyone and make sure that there was not any questions that have been posted that I have missed or anything like that. I really tried to make sure I am thorough in doing that. Let me see, who is this over here? I think I said hello to everybody. I appreciate you guys for tuning in and everything. So it is 5 more minutes. Any questions, any concerns, any show ideas, anything? Anyone? Alrighty, well, thank you so much for tuning in. Grace and peace. God bless. We appreciate you tuning in. Please, for Thanksgiving, let's talk about that for a few minutes. Please have a plan for Thanksgiving. Your plan should not be at the end of the year, I'm going to eat what I want and start afresh January 1. No, you need to practice good food choices and behavior now. For Thanksgiving, I have told my patients that have health challenges with their weight and releasing weight, eat off a saucer. There's going to be about 7 or 8 different dishes. So put whatever you can on that saucer, that small paper plate, and eat off of that, and then go to the next dish. Okay, please do not skip breakfast. Okay, I say this, do not skip breakfast. It's called break fast for a reason. You're breaking a fast. That's why it's called breakfast. BREAKFAST. You're breaking a fast. So get up in the morning, have breakfast. If your family is a family that eats dinner late, go ahead and eat a lunch. Okay, you do not want to starve yourself and then eat a whole lot when you do eat, because your body is going to be like, he or she is starving me. So what you're eating, I'm going to store as fat. So please don't do that, okay? Have a plan. If they're having things that you don't eat or you don't want, eat before you go if you're visiting, or don't eat and eat when you get home, or offer to bring something to the gathering or whatever. Just have a plan. When you don't, what is that saying? If you don't have a plan, you plan to fail. Okay, so you don't want to fail at this. Okay, you can do it. You can do all things through Christ Jesus who strengthens you, and you only get one you on this side of heaven. So take care of the temple that God has given you. Have a plan for the holidays, and then the Christmas is coming, and New Year's Eve and New Year's Day. Have a plan. And still work out and go to the gym. I am going to the gym Thursday morning because they have a class that I want to go to Thanksgiving morning. I am going to the gym, and I'm going to have breakfast, and I'm going to eat, and then I'm going to spend time with family, and I'm planning on going to the movies. So that is my plan. I'm still no this year, guys. I haven't eaten any meat. This January will be a whole year. I did one time have a little piece of I think it was chicken wing. It was smelling so good. I told my daughter, let me have some, but that's all I had the whole entire year as far as meat. But I thank God for the strength to be able to do that, and I feel amazing. I feel great. I have a lot of energy, even though I keep long hours, and I'm very active in the type of work that I do. And I just thank God for preserving and keeping me, for being disciplined in that. I do supplement with vitamin B12, and I do chromium, so that really, really helps me to keep my stamina up and keep me going. I also do my isogenesis. I also do my brain boost because I'm studying right now, so I need all the brain cells that I can get. And so tomorrow before I go lift weights, I'm going to do my nitric oxide 30 minutes before the gym, so I can have energy and just throw that back before I go to the gym. So yes, and I do my protein shakes after I work out because I've broke down muscle mass, so I need to build it back up. And I have been also doing my bedtime belly buster, which is my 1 scoop of protein with greens or fruit 30 minutes before I go to sleep. So everything that I tell you guys to do, I do it, and I try to stick to it because I can tell you to do it and not do it myself. I want to be a walking billboard. I want to be a poster child for you. If I can do it, you can do it too. And some of you that are under the sound of my voice that have been doing it too, and you have been feeling great and looking good, and I am so proud of you. Doris Ease, you have been telling people about it, and you have been releasing the weight. David Ease, thank you so much. Dion Collins, he's been telling everybody about it, and people have been coming to me saying, whatever they doing, I want to do it too. So this does work. It's a lifestyle, okay? This is not a one-hit wonder. I'm just going to get to a certain weight and then go back to my old ways. So I want to continue this the rest of my life so I can share with you all the goodness and the not wealth of knowledge of health that the Lord has intended us for to live. So thank you so much. Grace and peace. God bless. Bye for now. Happy Thanksgiving.